Life by Dr. Pat. Leading innovation in fertility excellence.
Deep Dive into Reproduction with Life by Dr. Pat.
Welcome to our deep dive on PCOS. We're going to, really explore what it is, how it's diagnosed, and what the treatment options are.
Sounds good.
So the sources today are excerpts from a Thai website specializing in fertility and infertility treatment, and a YouTube video from the same doctor, a reproductive endocrinologist.
Oh, interesting.
Yeah. Since the sources are in Thai, we'll be, summarizing those key points for you. What I found really fascinating was how cultural perspectives on healthcare can differ, and yet that core information, it remains the same.
Yeah, that's really interesting how medical knowledge can kind of, transcend borders. It's pretty cool.
Yeah, absolutely. And I have to say, I learned way more about PCOS than I ever thought possible.
Oh, really?
Yeah, it's way more complex than just having cysts on your ovaries, which is, I'll be honest, what I always assumed.
Right, yeah. The name polycystic ovary syndrome can be a bit misleading. It's not about surgically removing cysts.
Oh, okay.
It's a hormonal disorder that primarily affects how the ovaries function.
So if it's not about the cysts, then what is PCOS? Like, what's the main issue?
Well, PCOS is characterized by an imbalance of hormones.
Okay.
It's a condition where the ovaries produce more androgens than they should.
Androgens?
Androgens are typically thought of as male hormones, but everyone has them.
Right.
In people with PCOS, though, these higher androgen levels can contribute to a whole range of symptoms.
Okay, so then how do doctors actually figure out if someone has PCOS? Is it all about those excess androgens, or are there other things they're looking for?
Diagnosing PCOS can be a little tricky, and doctors use a set of criteria known as the Rotterdam Criteria.
The Rotterdam Criteria.
Yeah, it was established in 2003 by the European Society for Human Reproduction and Embryology.
Wow.
And the American Society for Reproductive Medicine.
Got it.
So it's kind of like a checklist with 3 main points.
A checklist. Okay, so walk me through this list. What are those 3 points?
So first, there's infrequent periods, meaning fewer than 10 menstrual cycles a year. The second point is high levels of androgens, like we just talked about. And finally, the presence of many small follicles on the ovaries, which are visible during an ultrasound.
So you need to have all 3 of those things to be diagnosed with PCOS?
Not necessarily. A PCOS diagnosis can be made if someone meets just 2 out of the 3 criteria.
Oh, okay.
But here's where it gets even more complex. Doctors have to rule out other conditions that can mimic PCOS.
Like what?
Like thyroid issues or certain types of tumors. They have to make sure what they're seeing is really PCOS and not something else entirely.
Oh, wow. So it's like a medical puzzle, almost.
Yeah, you could say that.
Finding the right pieces to fit together. That's interesting. So what about the cause of this hormonal imbalance? Do we know like a clear answer for what causes this?
Well, that's the million-dollar question, and unfortunately, we don't have a definitive answer yet.
Okay.
The exact cause of PCOS is still unknown. However, the prevailing theory points to a chain reaction that often starts with abdominal obesity.
So belly fat?
Yes, belly fat is a major player here.
Okay.
The theory is that excess belly fat can lead to something called insulin resistance.
Insulin resistance. I've heard that term before, but remind me, what does insulin do again? What is that?
So insulin is a hormone that helps your body use glucose or sugar for energy.
Okay.
When you have insulin resistance, your cells don't respond to insulin as well as they should. And this can lead to a buildup of glucose in your blood.
Okay, got it. So how does this all relate back to PCOS?
Well, this insulin resistance, which is often triggered by that excess belly fat, seems to disrupt ovarian function.
Okay.
Which in turn can lead to the development of PCOS. It's like a domino effect.
Okay, so like one thing leads to another, leads to another.
Exactly.
But what I found interesting is the doctor in our source material mentioned that PCOS can occur in people who aren't overweight.
That's right. Completely surprising.
Yeah.
In the video, he suggests that in these cases, PCOS could be due to irregularities in the pituitary gland.
Oh, the pituitary gland. I don't know much about that. Can you explain what that is?
Sure. Think of the pituitary gland as the master conductor of your endocrine system.
Okay.
It's a tiny gland in your brain that controls hormone production, including the hormones involved in PCOS.
Oh, I see. So even without that obesity factor, hormonal imbalances originating in the pituitary gland could still lead to PCOS.
Exactly. It really highlights just how complex this condition is.
Yeah.
And how much we still don't know about its underlying causes.
Okay, so we've covered what PCOS is and how it's diagnosed. Now, let's get to the part I think a lot of people are probably wondering about: treatment. What did our sources have to say about managing PCOS?
Well, the good news is that there are a variety of treatment options available,
Okay, that's good.
but the approach is very individualized.
Okay.
It depends on the person's specific symptoms, their overall health, and whether or not they're trying to conceive.
Gotcha. So no magic bullet, unfortunately.
Afraid not. But there are definitely some common threads in PCOS treatment that we can explore.
All right, so let's talk about those common threads. What are some of the typical treatment options doctors might recommend?
One of the first things doctors often emphasize is the importance of lifestyle changes,
Oh, okay.
particularly when it comes to addressing that domino effect we talked about earlier.
So tackling that belly fat and insulin resistance head on.
Exactly. Weight loss, especially reducing belly fat, is often crucial for managing PCOS.
Okay.
Even a small weight loss, as little as 5%, can make a significant difference in symptoms and overall health.
Wow. So 5%, that feels a lot more achievable than some drastic weight loss goal,
Absolutely. It's about making sustainable changes that you can stick with long term.
Right.
Now, diet and exercise play a huge role in this weight management strategy. The doctor in our sources really emphasize their importance.
Okay, so tell me more about that. What kind of diet and exercise recommendations did he give?
Well, he advocated for a balanced, healthy diet. Focusing on whole foods like fruits, vegetables, lean protein, and whole grains.
Okay.
He also emphasized the importance of limiting processed foods, sugary drinks, and unhealthy fats.
So pretty standard healthy eating advice, right?
Yeah, pretty
Oh,
much.
Okay.
But with a focus on managing insulin resistance,
Uh-huh.
he specifically recommended choosing foods with a low glycemic index, which basically means they won't spike your blood sugar as much.
Okay, that makes sense. And what about exercise? What
Okay.
kind of exercise did he recommend?
He recommended a combination of cardio and strength training.
Okay.
Cardio exercises like brisk walking, running, or swimming are great for burning calories and improving cardiovascular health.
Makes sense.
Strength training helps build muscle, which can boost your metabolism and make it easier to lose weight in the long run.
Gotcha. So it's like a good balance of those two.
Exactly. It's all about finding activities that you enjoy and that you can stick with.
Right, right. Consistency is key.
Yes, definitely.
So it sounds like lifestyle changes are a really big part of managing PCOS, but what if someone makes those changes and is still struggling? What are some other options?
That's where medications can come in.
Oh, okay.
Certain medications can be really helpful in managing PCOS symptoms and improving overall health.
Okay, I'm curious. Tell me more about these medications. What are some common ones used for PCOS?
One of the most commonly prescribed medications for PCOS is metformin.
Metformin.
Yes, metformin. It was originally developed to treat type 2 diabetes, but it's also very effective for PCOS.
Interesting. Okay, so how does metformin work for PCOS? Does it have something to do with insulin?
You got it. Metformin helps improve insulin sensitivity,
Okay.
meaning your body becomes better at using insulin.
All right.
This can have a positive impact on many PCOS symptoms, including irregular periods, excess androgens, and even fertility.
Wow, so it kind of addresses that, that root cause of insulin resistance we talked about.
Exactly. It's not a cure-all, but it can be a very effective tool.
That's great. What other medications are commonly used for PCOS?
Well, if someone is struggling with irregular periods or trying to conceive, doctors might prescribe medications to induce ovulation.
Induce ovulation, what does that mean?
It means to help stimulate the ovaries to release an egg.
Oh, I see. Okay. What are some examples of those medications?
Two commonly used medications for ovulation induction are clomiphene citrate and letrozole.
Okay, so we've got metformin for insulin resistance and then ovulation-inducing medications if someone is trying to get pregnant. Are there any other medications that are used for PCOS?
There are. Sometimes doctors will prescribe medications specifically to address the excess androgen levels in PCOS.
Oh, okay.
These medications can help reduce symptoms like acne and unwanted hair growth.
So it sounds like doctors really have a whole toolkit of medications to help manage PCOS depending on the individual's needs.
They do. But what's important is that medication is often used in conjunction with lifestyle changes. It's not one or the other, it's a combination approach.
Right. Okay, that makes a lot of sense. So we've talked about lifestyle changes and medications, but what if those options aren't enough? Are there other treatment options available for PCOS?
There are, and we'll dive into those in the next part of our deep dive.
All right, stay tuned for that. We'll be back in a moment to explore even more about PCOS treatment. Welcome back. So before the break, we were talking about the different medications used to manage PCOS. Now I'm curious, what happens when lifestyle changes and medication just, aren't enough? What happens if, let's say someone's trying to conceive and those things aren't working? What other options are out there?
Well, in those cases, we start looking at assisted reproductive technology, or RT.
RT. Okay, so that sounds like pretty high tech. Can you break that down for me a little bit? Like, what does that involve for someone with PCOS?
Sure. When it comes to PCOS and RT, two common procedures are often considered: intrauterine insemination, known as IUI,
Okay.
and in vitro fertilization, which you've probably heard of as IVF.
Right. IUI and IVF, I've heard of those, but honestly, I'm not totally clear on what they are. Could you walk me through how those procedures actually work?
Absolutely. So let's start with IUI. In this procedure, sperm is collected and then specially prepared, basically washed and concentrated, to increase the chances of fertilization.
Oh, okay.
Then, this concentrated sperm is directly placed into the uterus using a thin catheter. It's timed to coincide with ovulation, which is often aided by medication.
So it's kind of like giving the sperm a little extra help getting to where it needs to be?
Exactly. It kind of bypasses the cervix and puts the sperm right there in the uterus, closer to the egg. Now, IVF is a bit more complex.
Okay. So tell me more about IVF. What makes it more involved?
Well, IVF involves several steps. First, the woman takes fertility medications to stimulate the ovaries to produce multiple eggs.
Okay.
Then, those eggs are retrieved through a minor surgical procedure using a needle guided by ultrasound.
So they actually, extract the eggs from the ovaries.
Yes. And then they're fertilized with sperm in a laboratory setting.
Wow.
This is where the in vitro part comes in. In vitro means in glass, referring to the petri dish where fertilization occurs.
Fascinating. So then what happens after the eggs are fertilized in the lab?
The fertilized eggs, now embryos, are monitored and allowed to develop for a few days. Then, one or more of these embryos are carefully selected and transferred back into the woman's uterus.
It's amazing how science can literally create life in a lab. That's incredible. But I imagine there are unique challenges for PCOS patients going through IVF. What did our sources say about that?
You're right, PCOS does present some specific considerations when it comes to IVF.
Okay.
For example, one challenge is that PCOS patients often have many follicles, those little sacs in the ovaries that contain the eggs.
Right, we talked about that as one of the diagnostic criteria for PCOS.
Yeah.
So how does having many follicles make IVF treatment more complicated?
Well, while it might seem like having lots of follicles is a good thing for fertility, it can actually increase the risk of a complication called ovarian hyperstimulation syndrome, or OHSS.
OHSS, I've never heard of that. What is that?
OHSS is a condition that can occur when the ovaries become overstimulated by the fertility medications used in IVF.
Mm-hmm.
Essentially, the ovaries become swollen and painful, and it can sometimes lead to more serious complications.
That sounds pretty serious. So how do doctors minimize the risk of OHSS for PCOS patients going through IVF?
There are a few strategies. One approach, which the doctor in the video highly recommends, is to freeze all embryos for later transfer.
Wait, so instead of transferring the embryos right after fertilization, they freeze them and transfer them later. Why is that beneficial for PCOS patients?
It's all about giving the ovaries a chance to recover. By freezing the embryos, you can avoid transferring them during the period when the ovaries are still highly stimulated from the fertility medications, thereby reducing the risk of OHSS. The embryos can then be thawed and transferred later when the ovaries are back to their normal state.
So it's kind of like a safety precaution to protect against that OHSS.
Exactly. It's a common practice for PCOS patients undergoing IVF to minimize those risks and improve the chances of a successful pregnancy.
Okay, that makes sense. This is all so insightful. But before we go any further down, the IVF path, I want to take a step back for a second and just talk about living with PCOS in general, beyond fertility. What did our sources have to say about managing this condition for just overall health and well-being, even if someone isn't actively trying to have children?
That's a really important point. The doctor in our source material emphasized that PCOS isn't just about fertility. It's a condition that can have, a ripple effect on many aspects of health.
Yeah.
Managing PCOS is crucial for overall well-being, whether or not someone wants to conceive.
That's a good reminder. It's not just a women's issue, focused only on reproductive health.
Right.
It can impact someone's life in a lot of different ways.
Absolutely. And a lot of the management strategies we've already discussed, like lifestyle changes and certain medications, are beneficial for overall health regardless of fertility goals.
Right.
For example, maintaining a healthy weight, eating a balanced diet, and exercising regularly can help improve insulin sensitivity, reduce the risk of heart disease, and boost mood.
Yeah.
Benefits everyone could appreciate.
Absolutely. It's about taking a holistic approach to health, recognizing that everything's connected.
Exactly. And this brings us to something really fascinating that the doctor touched upon in the video, which I think you'll find interesting.
Oh, I love where this is going. Okay, what caught your attention?
He emphasized this interconnectedness of different bodily systems, how they influence each other.
Yeah.
Remember when we talked about that domino effect of abdominal obesity leading to insulin resistance and then potentially PCOS?
Right.
Well, he takes that concept a step further and highlights how other factors, like stress and sleep, can also play a role in this hormonal cascade that contributes to PCOS.
Oh, that's so interesting. It really underscores the importance of taking care of our whole selves, not just focusing on one isolated aspect of health.
Exactly. It's like a puzzle where all the pieces fit together.
Yeah.
If one piece is out of place, it can disrupt the whole picture.
I love that analogy. So it sounds like managing PCOS effectively involves this kind of multi-pronged approach that addresses not only diet and exercise, but also, stress levels, sleep quality, potentially other lifestyle factors that can impact hormonal balance.
Precisely. It's about tuning into your body, listening to its signals, and making choices that support, overall well-being. And speaking of interconnectedness, there's another fascinating area of research that's emerging in the context of PCOS that I think we should explore.
Okay, I'm all ears. Tell me more about this intriguing new research. What's the focus?
It's all about the gut.
The gut. Wait, what does gut health have to do with PCOS?
It might seem surprising, but there's a growing body of research exploring this intricate link between gut health and PCOS. And what's fascinating is that this research is revealing just how much our gut health can impact our hormonal balance, our metabolism, and our overall well-being.
Okay, I'm officially intrigued. Break this down for me. What's the connection between the gut and PCOS?
Well, you see, our gut is home to trillions of bacteria, collectively known as the gut microbiome.
Okay.
This diverse community of microorganisms plays a vital role in digestion, immune function, and, you guessed it, hormone regulation.
So are you saying that an imbalance in these gut bacteria could potentially mess with hormones and contribute to PCOS?
That's exactly what the research is suggesting. Some studies have found that women with PCOS tend to have alterations in their gut microbiome compared to women without the condition.
So what kind of alterations are we talking about? Is it bad bacteria taking over?
Not necessarily bad bacteria taking over, but more like a lack of diversity in the gut microbiome. Think of it like a garden. A healthy gut microbiome is like a thriving garden with a wide variety of plants, each contributing its unique benefits. But in PCOS, research suggests that there's often less diversity, like a garden with only a few types of plants. This lack of diversity can disrupt the balance of the gut ecosystem and impact its ability to function optimally.
So less variety in the gut garden, so to speak?
Precisely. And this lack of diversity has been linked to inflammation, insulin resistance, which we know is a key factor in PCOS,
Right.
and even those pesky androgen hormones that are often elevated in PCOS.
Wow. So it's like that domino effect we talked about earlier, but this time it's starting in the gut. What's causing these gut microbiome imbalances in the first place? Is there a clear culprit?
That's still an area of active research, but several factors could be at play.
Okay.
Diet definitely seems to have a major influence. For example, diets high in processed foods, sugar, and unhealthy fats have been linked to gut microbiome disruptions.
So what we eat can directly impact that balance of bacteria in our gut, which can then influence our hormones and potentially contribute to PCOS. It's like this whole chain reaction.
Exactly. And it's not just diet. Other factors like environmental exposures, certain medications like antibiotics, and even genetics can play a role in shaping the gut microbiome. It's a complex interplay of nature and nurture.
It's fascinating how everything is so interconnected. So if gut health can influence PCOS, are there things that we can do to support a healthy gut microbiome and potentially improve PCOS symptoms?
That's the great news. There are absolutely things we can do to nurture our gut microbiome and promote its diversity and balance. And these strategies can have a positive ripple effect on overall health, including PCOS.
Okay, I want to hear these gut-friendly secrets. What can we do to cultivate a healthy gut microbiome?
Well, diet is a powerful tool. Focus on eating a variety of fiber-rich foods like fruits, vegetables, legumes, and whole grains. These foods act as prebiotics, which basically means they provide nourishment for the beneficial bacteria in your gut. Think of prebiotics as fertilizer for your gut garden.
Okay, so we're feeding those good gut bugs. What else is on the menu for a healthy gut?
They also love fermented foods, which are rich in probiotics. Probiotics are live beneficial bacteria that can help replenish and diversify the gut microbiome. Think yogurt with live and active cultures, kefir, sauerkraut, kimchi, all those tangy and delicious fermented delights.
Yeah, those are definitely some gut-friendly recommendations I can get behind. But is food the only way to influence gut health?
Not necessarily. Managing stress can also have a positive impact on your gut microbiome. When we're chronically stressed, it can throw our gut bacteria out of whack. Stress hormones can disrupt that delicate balance of the gut ecosystem.
So finding healthy ways to manage stress, good for the mind and the gut. Double win.
Exactly.
Yeah.
Techniques like yoga, meditation, deep breathing exercises, spending time in nature, anything that helps you relax and de-stress can benefit your gut health as well.
This is all so fascinating. It really underscores how interconnected our bodies are, you know? Hormones, gut health, mental well-being, it's all intertwined.
It truly is a symphony of systems working together. And when one system is out of tune, it can have ripple effects throughout the body.
Speaking of ripple effects, did the doctor in our source material mention anything about how, addressing gut health might impact PCOS symptoms? Like, were there any insights into whether these gut-friendly strategies could actually make a difference?
While these specific sources didn't delve into treatment outcomes or specific studies, emerging research does suggest that improving gut health may help to manage those PCOS symptoms.
So things like reducing inflammation, improving insulin sensitivity, maybe even regulating those androgen hormones, all those things we talked about, could potentially be influenced by nurturing a healthy gut.
Yeah. Exactly. It's still early days in terms of research, but it's a promising avenue for exploring new approaches to PCOS management. And the great thing is that many of these gut-friendly strategies like eating a balanced diet, managing stress, incorporating fermented foods are already aligned with, overall healthy living.
Yeah. It's exciting to think that something as simple as taking care of your gut could have such a profound impact on your health and potentially make a difference in managing PCOS. It really empowers you to take control of your own well-being.
It does. And it speaks to the power of a holistic approach,
Yeah.
addressing the root cause rather than just treating symptoms.
Well said. Now, while we've covered a lot of ground today, from hormone imbalances to IVF to this fascinating world of gut health, I feel like we've only just, scratched the surface of this really complex condition.
You're right. PCOS is a multifaceted condition, and there's always more to learn and explore. But I think this deep dive has provided a solid foundation for understanding the basics and has hopefully sparked some curiosity to delve even deeper into the world of PCOS.
Absolutely. But before we wrap things up, I'm curious, are there any other key takeaways or final thoughts that you'd like to leave our listener with?
One thing I'd like to emphasize is that PCOS is not a one-size-fits-all condition.
Right.
It's complex and individual, and the journey to understanding and managing it is unique for each person. Embrace that individuality. Seek support from healthcare providers and other people with PCOS. And remember that knowledge is your most powerful tool.
I love that. It's a reminder that you're not alone in this journey, and there's a whole community of support out there. Well, folks, we've come to the end of our deep dive into PCOS. I hope you found this exploration as insightful and empowering as I have. And remember, if you're concerned about PCOS or any other health condition, it's crucial to seek guidance from, a qualified healthcare professional. They can provide personalized advice and support tailored to your individual needs.
Couldn't agree more.
And with that, it's time to sign off. But before we do, any final parting words?
Perhaps a reminder to tune into your body, listen to what it's telling you, and don't hesitate to advocate for your own health and well-being.
Beautifully said. And with that, we bid you farewell. Until next time, happy deep diving.
Welcome back to our final part of this deep dive into PCOS. We've covered a lot of ground already, like understanding what PCOS is and exploring the treatment options. But before we wrap things up, I want to go back to that connection between gut health and PCOS. It's, relatively new research, but it feels like it could really change how we manage PCOS.
Yeah, it's definitely an area that's getting more attention. And it's exciting because it offers a new way to look at PCOS. And hopefully develop new strategies to, help those with it.
Okay, so can you remind me, how is gut health actually connected to PCOS? It still seems like a surprising link to me. It might seem surprising at first, but when you think about it, it makes sense. Our gut is home to trillions of bacteria, fungi, and other microorganisms, a really diverse ecosystem that we call the gut microbiome. And this microbiome plays a crucial role in a lot of aspects of our health. Digestion, immunity, and we're learning, even hormone regulation.
So the idea is that an imbalance in this gut microbiome could throw off our hormones and contribute to PCOS.
That's what the research is pointing to. Now, it's still early and we need more research, but several studies have found differences in the gut microbiome of women with PCOS compared to women without the condition.
Okay, so what kind of differences are we talking about? What's going on in the gut that could be linked to PCOS?
One key difference that researchers have found is a decrease in the diversity of bacteria in the gut microbiome of women with PCOS. Imagine your gut microbiome like a rainforest. It's a thriving ecosystem, a wide variety of species. A healthy gut microbiome has this diversity, lots of different types of bacteria, each one playing a unique role, all contributing to the balance of that ecosystem.
Okay, I like that analogy. So a healthy gut is like this diverse rainforest, but what about women with PCOS? What does their rainforest look like?
Well, research suggests that the gut microbiome in women with PCOS has less diversity, more like a forest that's been cleared and replanted with only a few types of trees. And this lack of diversity, it can have a cascading effect. It disrupts the balance of the gut ecosystem.
So it's not just bad bacteria, it's about the lack of overall diversity.
Exactly. And this lack of diversity, it's been linked to several health issues that we also see with PCOS, like inflammation, insulin resistance, and even those androgen levels.
So a less diverse gut microbiome could actually lead to those hormonal imbalances that, are so characteristic of PCOS. It's like all these puzzle pieces are coming together.
Right.
But what's causing this lack of diversity in the gut microbiome? Like, why are women with PCOS seeing this shift?
That's a great question, and researchers are trying to figure that out. There's no one answer, but several factors seem to be involved. Diet definitely plays a big role. Diets that are high in processed foods, sugar, and unhealthy fats, we know that they impact gut microbiome diversity.
So what we eat can directly change the balance of bacteria in our gut, and that can then impact our hormones and potentially lead to PCOS, like a chain reaction.
Exactly. And it's not just diet. Other things can affect it too, like chronic stress, exposure to environmental toxins, even things like antibiotics can all disrupt the gut microbiome.
So interesting how everything's connected. Our gut health is impacted by so many things in our lives. But if this less diverse gut microbiome is linked to those PCOS issues, what can we do about it? Is there anything we can do to shift the balance and create a healthier gut?
That's the good news. There's actually a lot we can do to help our gut microbiome.
Yeah.
And many of these strategies are things we've already talked about.
Okay, I'm ready. Give me the gut-friendly tips.
Okay, so diet is a great starting point. One of the best things you can do for your gut is to eat a variety of plant-based foods. So fruits, vegetables, legumes, whole grains, all of these fiber-rich foods, they act as prebiotics.
Prebiotics, those are the fertilizers for our gut garden, right?
Exactly. Prebiotics, they feed the beneficial bacteria in our gut, and they help them to flourish. And the more diverse your diet, the more diverse your gut microbiome will be.
So it's like, eat the rainbow.
Yeah.
Loading up on all those colorful fruits and veggies is a win-win.
Yes, absolutely. And in addition to prebiotics, there's also probiotics. Probiotics are live bacteria that can help replenish and diversify the gut microbiome.
Okay, yeah. Remind me, what are good sources of probiotics?
Fermented foods are a fantastic source of probiotics. Things like yogurt with live and active cultures, kefir, sauerkraut, kimchi, kombucha, all those delicious tangy treats are full of beneficial bacteria.
So having some yogurt at breakfast or adding fermented foods to our meals can help support gut health.
Exactly. And it's not just what you eat, it's how you eat. Taking the time to chew your food well, eating in a relaxed environment, listening to your body's hunger cues, all of this can support good digestion and a balanced gut microbiome.
It's a good reminder to really be mindful, to be present when we eat, not just rushing through our meals.
Right. And don't underestimate the power of stress management. Chronic stress can really mess with our gut bacteria, so finding healthy ways to manage stress is important.
So all those things like yoga, meditation, spending time in nature, anything that helps you de-stress, that can also help your gut.
Exactly. Taking care of our mental and emotional well-being is important for gut health too, not just what we eat.
This is so fascinating. It really highlights how connected our bodies are. It's not just our hormones or gut, it's our mental well-being too. It's all related.
It really is. Our bodies are complex systems that are all linked together.
Well, this has been such an interesting exploration. It's amazing to think that taking care of our gut could actually help us manage PCOS.
Right.
It's really empowering.
It is. It highlights the power of a holistic approach to health. We're not just treating symptoms, but trying to get at the root cause.
I agree. But it's important to remember that research on the gut microbiome and PCOS is still ongoing. We don't have all the answers yet.
Absolutely. We need more research to fully understand this complex relationship.
It's so important to stay informed, talk to your healthcare provider about any questions or concerns you have, and remember, what works for one person may not work for another. It's all about finding what's right for you. Well, folks, we've reached the end of our deep dive into PCOS. I hope you found it insightful, empowering, and maybe even a little bit surprising.
I think we covered a lot today. We talked about the hormones involved in PCOS, the criteria for diagnosis, treatment options, and the exciting research on the gut microbiome.
Yeah, there's always more to learn, and knowledge is power when it comes to your health.
Absolutely.
And with that, we say goodbye. Until next time, happy deep diving.
Leading. Innovation. Fertility. Excellence. Life by Dr. Pat. Leading innovation in fertility excellence.